flu season is almost here, and now is the time to start protecting you and your family. Joining us now is Dr. Alozi.
Hello.
I'm glad you're here with us.
Thanks for having me.
Get Ready Day is just 2 days away. So can you talk to us about Get Ready Day and what are we getting ready for?
So Get Ready Day is actually tomorrow. So it's the third Tuesday of September. So it's actually tomorrow. And it's part of the preparedness. Yeah, it's part of preparedness to get people thinking about natural disasters, flu, influenza, a host of other things, right? And so this is just one of the things to get people to be aware of the flu shot, what they need to do, and kind of go from there.
Okay, well that makes sense. Tomorrow,
exactly.
Not the day after.
Exactly.
Well, talk to us about the number of Americans affected by the flu.
You know, people don't realize this, but a lot of people get the flu, right? So every year we get somewhere between 3 and 10% of the population that actually get infected with influenza, and then up to 700,000 people actually get admitted for hospitalizations and complications. So it's not a trifling matter. It's not something to play around with. The important thing is that the flu shot is there to help us, and so I think that's what we're going to talk about as well.
Okay, so how many positive tests were reported this year and last year?
Ooh, that's a hard one. I think the total was about 200,000, but you can see in the screen that that spike is last year.
Okay.
Right? Where we are right now is to the far right. So flu season really hasn't kicked off. What we've been seeing a lot of recently has been COVID. All throughout the summer, it felt like everybody had COVID. We haven't gotten there. And the good thing is that when you look at the prediction models that are coming, they actually feel as if even if you take influenza plus COVID, it's going to be less than last year, right? So that's a good sign for us, right? However, it's not that people should get their flu shot, they still should get their flu shot.
Okay, but should we be concerned about the upcoming flu season?
I think you should always be concerned, especially if you hit a couple of risk categories, right? So for example, if you have children in your house that are under 5, if you're above the age of 60, if you have chronic medical conditions like asthma, obesity, really bad diabetes, if you're on cancer chemotherapy, those are all things that you really can't afford to get sick. Pregnant women for sure should get the flu shot because that can actually make them sick and it cause an early termination of their pregnancy.
Okay, so we say pregnant women, elderly, children?
Children and chronic medical conditions. Absolutely, you got it. That was easy.
So what are the best ways we can take care of ourselves? I know we should wash our hands, but what else can we do?
Yeah, I mean, it's one of those things, right? People always talk about, do I wear a mask, do I not wear a mask? I'm not necessarily big on masks one way or the other because they don't protect you really against those kind of infections. I do think the best way to protect yourself year over year is getting a flu shot, right? Especially if you're in one of those 4 categories, get a flu shot. Us in healthcare are kind of mandated to get a flu shot every year, and not just for us, it's to help protect other people in the hospital, right? And then if you're sick, and we learned this during COVID, we should have known this before, stay home. And it's not always easy to stay home, I get that. But if you're sick, stay home. That's the #1 thing you can do to avoid making other people sick. Okay,
so what do you say to the people that are worried about the vaccine? I hear this all the time.
Yeah,
if I get the flu shot, I'm going to get sick.
We have so much vaccine denialism in the United States. Some of it's political, some of it's just a lot of things that have happened in the last 20 years. I do think that people have to understand that on average, vaccines are safe, right? There's not an increase in other comorbidities because of vaccines. You may still get sick because remembering, it's creating an immune reaction in your body that's going to make you feel kind of, oh, my arm's sore and a host of other things. That's not the flu, and downstream will protect you against getting a bad case of the flu.
I know exactly what that feels like.
It's miserable.
Okay, so where can we go to get the vaccine?
Luckily, there's a lot of different places, right? You can see them on the screen. The health department does a good job. You can go to their website. They have pop-ups all over the place. There's Fire Feast, there's Fabens, free flu shot clinics all across the community, but I think it's important. If you don't want to go there, work with your clinician, go to their office, Walgreens, CVS, a lot of the schools do them. Get your flu shot. Flu season's coming. You don't want to get sick.
All right, Dr. Alozi, thank you as always.
As always, thank you.
Still ahead, fall is in the air.